A few years back I wrote a column about you and Jaden, and the title was What Can Ottawa Do About Autism? So I want you to talk a little bit about policy. There's a lot of families here. What can Ottawa or government in general do to make life easier for you and Jaden and many other families?
Well, it's interesting because, of course, you've gone through the sort of provincial. I talked about this a little bit in my speaking earlier. The jurisdiction falls with the provinces for most of the hotspots with autism. Whether it be education, healthcare, social services, those things. What we did at the federal level, the last two budgets when we were in government in 14 and 15 were the first two that included anything for autism at all. The 14 one was vocational, money for a vocational program, actually a couple of vocational programs to get people, adults with autism working, or even actually teenagers with autism working with mentors and getting some work experience, and then adults working through the Ready, Willing, and Able program. In 2015, what got funded, and actually it's interesting because Evdokia was in one of the key meetings with the Prime Minister's office at the time, where we had 6 of the stakeholders, experts talking about this. We worked and put in a funding for a working group on a Canadian autism partnership. So it was the working group only right now. That working group continues to work right now. Stephen Shearer, who Evdokia mentioned, is part of that working group right now. There's 12 people working to establish a sort of a, I don't know if it'll be permanent, but a Canadian autism partnership which would advise governments in their area of jurisdiction on what the best advice possible is. So when it's fully up and running, they would work with the government of Ontario, for example, to tell them what's the best advice, best evidence from around the world for an early intervention program, or it might be a housing program. At the federal level, it might be a program dealing with vocational opportunities or First Nations or whatever it might be. But again, bringing all experts from across the country together, speaking from one page in a sense on what the best evidence shows from around the world, and advising governments in their area of jurisdiction. Really, really important to kind of sort through that, to give whatever government the best information they can have.
And one of the other things you've pushed for over the years is you've talked about the need for an autism strategy. In Canada, we have a mental health strategy, we have a cancer strategy, we have a diabetes strategy. What would an autism strategy, how would that make life better for families?
That's actually really interesting in light of what I was just saying, because one of the challenges with strategy, a national strategy, is because so many of the areas are provincial in nature. It sounds good to say that there's a national strategy, but if the provinces aren't on board, that's a problem. So what this autism partnership, the shape that it's taken, one of the things that they put forward in the proposal was the idea that the partnership itself would put together a strategy, develop a strategy, and then work with governments to implement that strategy. So the partnership funded by the federal government would, in a sense, own the strategy. One of the conversations that I've had with the stakeholders from across the country, Esther, I know you've been part of that conversation. There's probably several people in this room that have been part of that conversation, is to challenge families, challenge stakeholders to say, if you're gonna ask for a strategy, it's one thing to come to the Hill and demand a national autism strategy, but I found that conversation never included what would actually be in the national autism strategy. And so now the stakeholders have come together and started to list things off. And I remember one particular meeting where we came together with a goal to have action, real action, come out of the meeting without just another meeting planned, but with a list of 8 things that we could. With a list of 8 things that we could actually execute, in a sense, and work towards in terms of what a strategy would look like. So real action for families. And of course, those things that I've listed, like early intervention, housing, those kind of things are the things that come out of that.
And Evdokia, you hinted at this a bit right at the end of your talk about getting more input from families to figure out what their research priorities are. Give us a little hint of what you think you'll hear, because you work with families, you have a sense of what they're going to say without knowing everything. What are the priorities, aside from the work, the everyday stuff? What are the research priorities for families?
So it's a good question. I can give you a little bit of a sense of what we think we're going to get, but before I do that, I want to tell you why it's important that I don't actually make assumptions. So a perfect example of where this particular process surprised everybody was in the case of renal failure. So for patients who have renal failure, a lot of our research has gone into transplant research, maintaining their transplants, maintaining their quality of life for transplants, and so on. When the process actually took place, one of the top 10 priorities was something called pruritus, which basically is itching. So people who have renal failure itch a lot, and it has a huge effect on their quality of life. But it didn't occur any of the researchers. You can't hear me. So patients who have renal failure itch. They get an itching sensation, which actually has a huge effect on their quality of life. But it didn't occur to any of us researchers that itching should be a focus of research for patients with renal failure. We were all occupied, they were all occupied with how to actually get the transplants working better. Not that the transplants are not extremely important, but we missed the itching, which was extremely important. So we have to make sure, part of the reason we're doing this process is because we have a certain lens. The researchers have a certain lens, and sometimes we forget the obvious things that may be high priority for patients and families. But now, back to your question, in terms of what we hear in these original focus groups and in our clinical practice, depending on the stage of life of the person who has autism, their families and these people have different priorities. So you can imagine that early after diagnosis, parents are looking for big impact interventions, who will change the developmental trajectory, who will move the kids into more favorable outcomes. And as these kids grow and we're reaching adolescence, then you're seeing parents and kids asking for more mental health interventions. This is the time where mental health becomes compromised. And they're starting to think about self-efficacy and how these people will advocate for themselves and actually determine their life course. And as we get to transition to adulthood, this is when, as we all know, the auditor's report came out this summer, the Ombudsman's report. Things fall completely apart because we have actually no service sector in Ontario to speak of for adults who have high developmental needs. And so there, it's about housing, it's about vocational, it's about protecting their safety, about the legal system, and protection within the legal system and so on. So we're expecting some of these themes to come up, but honestly, I also expect to be surprised. So we're completely open. We need people to do the survey so that we can hear your voice.
That sounds like a challenge to the audience to surprise you.
Please surprise me.
So I want to come back to the adults with autism in a minute. Before I do that, though, I'm interested in the numbers, because in the media we write a lot about the numbers. They keep changing constantly, the number of people with autism. I think the latest CDC report was 1 in 50 now, children. So are there more kids with autism? Are we just more aware? Are we testing differently? What's the explanation?
So it's a hard question. I would say part of the problem is our obsession with the labels. We're getting back to this labeling thing. So if I am to get service if I have autism, but I am not to get service if I have a developmental challenge with some autistic features, I, as a physician, I will write autism spectrum disorder. Now, does this mean that this kid has different biology than a kid with autism spectrum disorder? I don't know that, right? In fact, I have started questioning whether any of this makes any, in terms of the labeling, makes any sense. So it is possible that we are relabeling quite a bit of what we called other things before, such as your intellectual disability part, so the kids who are very low functioning, or the opposite end of the spectrum, right? So the odd kid in your class that did fine but needed some supports or didn't do so fine because it didn't have supports, now gets an autism diagnosis. So part of it is the relabeling. On the other hand, as a researcher, if this was cancer or if this was another disorder and the numbers were going up so high, we would not be too quick to say this is just a relabeling problem. So I think we have to prove to ourselves that there is not a biological mechanism that somewhat increases the numbers. And one way to think about this is that, yes, a lot of autism lives in our genetic materials, but the environment translates into our bodies through our genetic material. So when we get exposed to the environment, it is our genetic makeup that decides what type of response we're going to have to this environment. So the one thing we don't want to miss is that there is some interaction between our environment and our genes that's producing now higher numbers. And a lot of research work is going in that area.
So a lot of epigenetics work.
Epigenetics, yes.
So Mike, I want to come back to Jaden's 20, he's a young man. Let's talk a little bit about why do we never hear about adults with autism? It's always kids with autism. You know, he's a man now. What's going to happen to him? We know from the report, the Ombudsman's report, that a lot of people just fall through the cracks and stuff. Is that a big worry for you as a family member?
Well, absolutely. And I mean, I think actually to Evdokia's point, we may not know, what's driving the numbers, but we do know that the number of people being diagnosed is going up for whatever reason that is. And Jaden is kind of at the front edge of that in a sense. I know that in Alberta, he was one of the first kids to get treatment at 2 years old without having to go through a lengthy process, appeal process to get there. And so now that sort of front edge is in their 20s in terms of the big numbers. There are people older than that with autism, but definitely a lot of pressure right now to make sure that there's services there for them. And I think this is something that again the Autism Partnership is seized with. I know that the leaders within the autism community they understand this. This is a point in time too when you get self-advocates who are willing to speak up and be a part of that conversation as well. And there's a real strength in that. So just like we saw the impact on the early childhood, early intervention stuff because parents advocated probably stronger than anybody, I think what we need, and I would challenge folks in the room, as I said in one of the interviews, take the time to go in and see your MPP, particularly because most of these things are delivered provincially. People, regardless of party, get into politics because they want to make a difference, and oftentimes they just don't understand exactly what it is that's going on in every person's life. And if you have the opportunity to go in, if you have, as a self-advocate, the opportunity to go in on your own, but if you're a parent or a sibling of a young adult with autism, take them in to see their MPP and have a conversation about what life is like, because I really think that it doesn't matter what party you're a part of. If you get a chance to hear and witness and see those challenges, I think that you're far more likely to make the right decision when it comes to policy.
And Evdokia, I want to come back to another little quirk of this, if I can, of the numbers. Maybe because I work for the Globe, I'm fascinated with numbers. We love numbers, especially if they have dollar signs in front of them. But I'm interested in, is there an easy explanation for why so many more boys than girls, or is it girls just underdiagnosed? What's the explanation?
That's another $1 million question. It's a really, really good question. And those of us who are obsessed with understanding biology are obsessed with that question. I don't have good answers, but I can give you a couple of kind of hints about where the research is going. So yeah, we do think that we underdiagnose girls. So an autistic girl walks in my office and pulls out the Barbie and starts playing with the Barbie. A lot of clinicians in the community would not have called that girl autistic. If we properly test that girl, we'll see that there are plenty of difficulties in the social domain that warranty the diagnosis of autism. So it is possible that we're underdiagnosing. The other area of underdiagnosis has to do with our diagnostic instruments. So it's important to know that our diagnostic instruments were validated in boys. And so if the girls present very different ways, our diagnostic instruments are not very good at picking up those girls. Having said that, there is a huge difference in the boys versus girls in the autism spectrum, and we do believe that some of that is real. And so we're trying to use that to figure out the biology that drives that. And there are several theories out there, some more popular than others. It has to do with, some of them have to do with genes that live in the X chromosome. So us girls have 2 X chromosomes. So if you carry 1 copy of that gene in your X chromosome and you have one good one, let's say, or one not different, then the impact of that different gene is much less. But if that particular gene on the X chromosome happens in a boy, there is no other X chromosome to counterbalance that. And so there is some idea that some of the X chromosome genetic difference may be important for that. There's a second theory that has to do with exposure to testosterone during fetal environment. That has been challenged a little bit, but the truth is it's still out there and there is still some valid points about it, so we haven't completely resolved the question. So are there any exposures? This is where the exposure story comes in, that would increase androgen exposure, testosterone exposure in the fetal environment, that would move, masculinize, if you like, the brain a little bit, and make it more likely for boys to get autism? These are very good questions. Again, lots of work, not very clear answers, but very interesting, because if we understand that difference, we may understand quite a bit about the biology that's at the origins of developing this autism spectrum.
So let's stick with a little more science, because this is fascinating. You mentioned again in passing about this notion of doing whole exome testing for kids who are believed to have autism. What's the point of doing that if there's, you said, I think 400 gene candidates? Why would you do it? Is it going to give answers?
Yeah. So I mean, it depends on the answer you want to get. So I'll give you the answer from my perspective. So I'm interested in treatment. And so the reason I'm interested in genetics is because if I understand the genetics and I can map it onto a brain pathway or a metabolic pathway, then I have a potential target for a new treatment. So I want to understand all the genomic variation that may exist in the autism population that has autism spectrum disorder, because this gives me targets for interventions. It's also important for families, and different families make different decisions about how to handle inherited risk. So we have to be careful when we say genetic. Genetic doesn't mean inherited. So we all have genetic material, but in fact, half of the mutations, the differences that we find in kids with autism, happen at random, if you like, at the time of conception. They're not inherited by their parents. So we have to be careful when we say genetic to remember that this means that it lives in our genetic material, but it doesn't mean that it runs in the family. And so a lot of families are interested to find out whether this genetic difference runs in the family, so they can make appropriate decisions for follow-up pregnancies or for children. Their children, when they grow up, they want to know if they carry this particular variation. These are very personal, individual decisions that none of us have the right to be involved, but some of the families want to know this type of information to help them make those decisions. But for me, ultimately, it is about identifying, understanding the biology. So if the small pieces, the small different variations that we find with exome sequencing clarify the biology, that would be a huge gain in our ability to develop treatments and therapies that actually target the underlying biology and can move the developmental trajectories.
And is there a great likelihood that testing is going to happen? It's becoming much more affordable now.
It's becoming much more affordable, and we are in negotiations. Dr. Steve Serer's group is in negotiations with the government. So as far as I know, it is a potentially outcome to come soon.
So I want to just indulge you for one last question. I want to end with you, Mike. Every parent wants their children to succeed. I want you to wrap up the evening for us by telling me what's success for Jaden, what's success for you?
Well, when Jaden's working, when he's doing something that he loves to do, he can work for hours doing the same thing, and when he's done, he sometimes will cry because he doesn't want to stop working. You know, how many of you cry at the end of your shift because you? Not too many. I want Jaden to do something that he loves that much, and I want him to be compensated for it fairly because he's good at it. And I want to have a system that works as hard as it can to help him work through the challenges he has while he does that. But more than anything, I want him to be able to contribute in a way that's meaningful, not just to him, but meaningful to the rest of us. And I think as a society, as we focus on those things, we become better as a society.
So you want him to reach his full potential like every other kid?
Absolutely, just like I want that for everybody in this room.